Artificial tears are the most commonly prescribed dry eye treatment, but for a long time they've been viewed as purely a form of symptom relief. New research though that's just been released is showing that artificial tears do more than just treat symptoms. In this video I'll be going through the results of this latest research and go through how to best prescribe those drops. Artificial tears have now been shown to actually treat dry eye. In the past, we just thought that artificial tears purely gave short-term symptom relief. But a new study that's headed by Professor Jennifer Craig at the University of Auckland has shown that artificial tears, if prescribed correctly and for a long enough period of time, can actually give permanent improvements in clinical signs and symptoms of dry eye. To treat dry eye effectively with artificial tears, patients need to take the drops consistently and for a long period of time. So the key number is 4 times a day. Patients need to be on drops for at least 4 times a day and for a period of 3 to 6 months. After a month of treatment, they'll begin to notice improvements in their symptoms, and clinical signs will begin to show improvements in approximately 3 months. The majority of drops available to treat dry eyes come in a preserved form. These drops are actually very effective, but for patients that need to use drops for a prolonged period of time, the preservative in the drops can actually start to cause damage to the ocular surface. So for your dry eye patients, make sure that you're prescribing non-preserved eye drops. Artificial tears are a good option for patients that are experiencing discomfort with contact lens wear. In the past, we used to think that you shouldn't prescribe preserved drops for patients wearing contact lenses, but modern preservatives are actually safe to be used with contact lenses. However, if you've got a dry eye patient, the same thing applies. You really need to use a non-preserved eye drop for those patients. In addition to treating dry eyes, artificial tears can actually be prescribed to help prevent dry eye symptoms from taking place to start off with. A recent study has shown that artificial tears can be prescribed to help prevent symptoms from starting in adverse conditions. Between the two types of drops, lipid-based and non-lipid-based, lipid-based drops have actually been shown to be even more effective in preventing dry eye in those environments.